acne routine. Okay, so if you guys are interested in acne routine, one of the best things that you can be doing for an acne routine is you want to be using a great benzoyl peroxide 4 or 5% cleanser in the morning. I really like the one by CeraVe. Panoxyl makes a great one too. You want to use that in the morning, and you want to use benzoyl peroxide in your routine because that actually helps to oxidize and destroy acne bacteria on your skin, which is a major cause of acne. Acne is caused by a lot of things. It's also a little bit anti-inflammatory. And then after that, all you really need to do is, use non-comedogenic and oil-free products. Because if you use other products that are comedogenic, they can actually block your pores and cause more acne breakouts. And then at bedtime, if you're trying to limit acne and pimples, you want to use a retinoid, and you can get a previously prescription-only retinoid called adapalene now over the counter. I really, really like the either the acne-free version or La Roche-Posay version. Different also makes a version. Different was actually the one who made the prescription product originally, and now you can get that over the counter. So that's very good. When you're talking about cystic acne, I've got a lot of videos on this, but cystic acne usually often has to be treated with oral medicines, things like that. They're going to be a little bit, dude, Dr. Tomasian, bro, I miss you. You see Chris in the chat. He's saying he misses me, dude. The guy doesn't even know. I text him, dude, we said we need to go get something, and he said he needs to get something. I said, man, I thought this was we, baby. That's what I said. I was like, I thought this was a we thing, and he says, I need to. Read it back, Chris. It broke my heart, bro. I thought we were going together. I thought you were going to take me to your spot, and we're going to go do that. So anyway, so we're back. Castor oil or apricot oil better? Neither of these are good when it comes to it. Mia, thanks for being here. Thanks for the good games. Princess, thanks for the rose. Appreciate you. So can acne scars be healed? They cannot be erased completely, but they can be improved. They definitely can be improved with things like peel, with things like lasers. These things can help get your acne scars better for sure. So I would see your dermatologist, find out what kind of effective treatments that they have for you, because you got to find out what options that they have for you and what they feel most comfortable with, with what they can do. So I would definitely look into that and kind of go from there. So does Accutane have bad long-term effects? Generally, no. And in fact, I've taken two people off Accutane. One person, the issue was they got a little bit moody. They were a teenager, so they were already kind of a little bit of a moody kind of kid. The other guy, a little bit more worrisomely, developed some joint pain. And you hear about this with Accutane. There are real problems that can happen with Accutane, but fortunately it's very rare. The most thing that happens with Accutane is people get a little irritated and they get a little bit dry, and sometimes they can even get some nosebleeds. You get very dry for a while. Millie on the eyelid is not something you want to tackle at home on your own. You want to definitely tackle that at the dermatologist. Have them get you in a safe place, and then go ahead and they can like nick those little Millie and get those off there. Me asked a great question. You guys to see if you got that skincare badge, if you got that super like, if you got those likes, if you got those supers, you're getting your questions answered first. If you're a skincare bestie, you're a subscriber, you're getting your skincare questions answered first. Every time, guys. I appreciate you guys so much for supporting the channel and being here. So Mia says, what's the type of laser you said for anti-aging? There's a lot of them. My best laser that I use is one called Contour TRL. It's a type of fully ablative erbium resurfacing laser. It's incredible. But for a lot of people, that's a lot. So the more common one I use for people is one called Halo, and it's a mix of ablative and non-ablative lasers. It can really help. Thank you guys for being here. If you're in here, I'm Dr. Dylan Greeney. I'm a board certified dermatologist. I'm here to help you get your best skin. You know, it's kind of hard to get in the dermatologist, but I'm here live with you right now. So if you have skincare questions, just ask them. I've been on social media helping you guys get your best skin for the last 3 or 4 years, help over 500,000 people get their best skin. It's awesome because in the clinic, I only get to reach about 31 people. I saw 31 people in the clinic today, but on here, I get to literally reach hundreds of thousands of people and help them get their best skin. So if you're here, you're in the right place. If you got friends that love skincare, invite them. If you drop those supers or you drop those subscribes, then you guys are the people that get your questions answered first. But no matter what, hey, Boolong, what's up? So what can I do if someone's already on Accutane? Oh, Kelsey says, I'm pregnant. I have tiny bumps all over my forehead. I've always had perfect skin. So that's super frustrating. You can get a variety of things. You can get a variety of things that can kind of happen there. A lot of common things are like the little pittosporum folliculitis that can happen. Also, sometimes, acne can happen on the forehead, and that can be very frustrating. If it's itchy, it's more likely to be that Malassezia yeast that causes folliculitis. And then we got Bulong here. You guys heard him on the mic. Bulong, what's up?
What's up, everybody?
So Bulong says, what's up? One thing I was going to say, Bulong, is we are live right now. I'm not set up to game because I didn't think you're coming. So what I would say is we could circle back, though, in a minute. If the game's on, you could watch the game. We could circle back.
Yeah.
Okay. But give me about 30 minutes. Belissa, thank you so much. First time subscriber, Belissa, you rock. Thank you. Make sure to drop that chat in any chat you got. Cystic acne is best treated with Accutane. Accutane is one of the best treatments that there is for acne, and the only thing that can cure acne permanently. Trey says, Cinna Rose, thank you. So Belissa, beautiful name, by the way. So Belissa says, I have tingling small bumps around the lining of my lips and my face. My derm thinks it's dermatitis. So there is a type of dermatitis that happens a lot. It can kind of have a little bit of a tingling and small bumps around the mouth. It's called perioral dermatitis or periorificial dermatitis. And it's usually treated with things like metronidazole, but I like using a combination of metronidazole, ivermectin, and azelaic acid. Now, these are prescription treatments. About the only one that you can get over the counter that might help is azelaic acid. I like the one from The Ordinary. Evil BF Imposter says, hello, what's up? Hi there, Evil. And Tis says, what's your recommendation on dark, big acne marks on the forearm? Really insecure about it. I haven't even tried vitamin C serum. It's not working. So the best thing you can get over the counter for that is going to be Remedy for Dark Spots. That's literally the name of it, Remedy for Dark Spots. It's a fantastic treatment. It's very, very good. So Belisa says, it's very painful. Nothing I'm using is helping. It is really frustrating. Those are incredibly frustrating. I think the fact that you're seeing a dermatologist is key, because sometimes with rashes in particular, you have to kind of work through things. You have to try different stuff. You have to stick to things. Nothing helps immediately, which can make it frustrating. But that is something that oftentimes you have to do to get down to the bottom of it. So we're kind of at the bottom of the chat, guys. If you're here, keep the questions coming. Psoriasis, there's really nothing you do over the counter. A little bit of natural sunlight does help psoriasis, but you got to be careful because increased UV exposure causes skin cancer. So you want to be careful about that. I appreciate you guys being here again. If you got to drop the supers, if you drop the subscribes, you get your questions answered first. What's your thoughts on beef tallow with moisturizer? I'm not about beef tallow. Generally, let food be thy medicine, meaning eat healthy, but food is not skincare. So don't do that. How do you get rid of milia? So milia are little tiny clogged oil bumps. You've been using the retinol and got off too after a few weeks. Well, that's good that you started going that direction. Retinol is a little bit weaker than a retinoid. I would bump it up to a retinoid. Something like adapalene is a good idea. Fungus on the upper back can be treated with things like terbinafine, which you get over the counter, or ketoconazole, which you get over the counter. Baby C, what's up in the chat, Baby C? Why is the skin by my nose and eyes on the inner getting wrinkled? I think it's the hyaluronic acid. Depends. We are at a time in the season where that humidity in the air is decreasing. So sometimes hyaluronic acid can dry out on your skin and make your skin look flaky and kind of tight. That can definitely happen. But is it causing wrinkles? Definitely not. Hyaluronic acid is definitely not going to cause wrinkles. The skin by my nose and by the eyes on the inner getting wrinkled. It's tough saying, because you got to remember, as time marches on, I mean, we're going to get normal wrinkles. If your skin is getting dry or is getting tight, sometimes wrinkles can show up more obviously than they would if not. I would lean into a great moisturizer and use a great skincare routine. So you want to be using a good vitamin C every morning. You want to be using a great, use a great sunscreen. And these are great ways to do that. Is zinc sulfate vitamins good for treating dermatitis? Zinc sulfate vitamins, as far as I'm concerned, I don't think there's a great, option there. I don't think I've literally never tried to treat. There are people that have zinc deficiencies that can get a dermatitis. So if they were worried that you had like a zinc deficiency, they might have told you to take zinc. Now, that is actually pretty interesting and also pretty rare. They might have, I don't know if you don't have a well-rounded diet, they might have kind of suggested that, but that's pretty rare, especially in the United States. So Trey says, getting cystic acne when using Differin on my neck, is it just purging? Not necessarily. I mean, you could have a few breakouts, because of that, but cystic acne can happen anywhere. The face, chest, back, any of those areas can come up. Sometimes when you start a retinoid or retinol, or as you're starting to treat your acne, things can get a little worse before they look better. I found it on my own doing research. Yeah, so you got to keep in mind, guys, when you guys look stuff up online, there's a lot of different types of dermatitis. There's allergic dermatitis, irritant contact dermatitis. There's, you can have diaper dermatitis. You can have lip lickers dermatitis. You can have eczema, which is a type of atopic dermatitis, right? Nummular dermatitis. There's all these different types of drug reactions that are dermatitis. So that's why it's kind of hard. It's kind of tough to like Google things and like feel it out, because you're talking about like an incredibly rare form of dermatitis around the mouth that most likely has nothing to do with zinc, most likely. Can sleeping with a humidifier help your skin? Absolutely, Mia. So sleeping with a humidifier over the winter months can definitely make a big difference for your skin. So that's something you can absolutely do over the winter months. My nose always gets red and inflamed. What could I do? It's tough. A lot of things that happen on the nose and the cheeks where it's red and inflamed can be things like rosacea. And another thing that can happen, that can kind of happen, or seborrheic dermatitis, which is kind of like a dandruff of the face. You can look those things up online and see if one kind of makes sense to you or the other. Of course, the dermatologist can help, help you kind of figure that out. In the end of the day, good, gentle skincare is key. That's something that's really important to do. And then Baby C says, I have another personal girl question. Are you okay with answering a personal question for females? I'm happy to answer any skincare question that you guys have. Just drop it in the chat, and I answer them publicly like this so everybody can learn from it. I don't really like answering DMs, one, because I don't want to give direct medical advice, but more importantly, I want everyone to learn from it. If I answer somebody's question in a DM, nobody else learns anything. Best things for scarring, really, Maddie, the best thing you can do for scarring is really just silicone gel sheets. That's a good idea. Silicone gel sheets can be helpful for scarring. If you're trying to fade a little bit of redness, that can be done with laser. Maybe a little bit of niacinamide can help with relieving some of the redness a little sooner. Starting to get texture changes on the skin on my chin. So it's very frustrating for sure. A good skincare routine in general can help keep texture down and keep your skin looking its best. So that's kind of your best bet with it. Baby C says, I have Fordyce spots, is what they call around the groin, and I've been to several doctors and they say it's from puberty. I hate them and they look like a disease. So you got to realize there's a lot of different types of normal skin, and you're basically talking about oil glands that can be found on the lips, they can be found on the breast tissue, they can be found in the vaginal area, and you got to take it for what it's worth. If your doctor says, hey, this is a normal type of skin finding, there's plenty of people that have normal skin that you got to know, hey, this is not anything harmful, and you got to embrace it. We all have different skin. We all have some texture. We all have pores. We all have oil glands, and which is basically what you have. So if they say it's not a disease, then you got to kind of embrace that. And if anybody's worried about it, you got to be able to tell them kind of what's going on and what's normal. There's plenty of things that we can't change about our skin, like the idea of like completely glass skin. You can't really get that. You can't remove all the pores in your skin. That's impossible. And your pores serve a purpose, just like the oil glands serve a purpose. So you can't get rid of that completely. And sometimes treatments that would potentially maybe try to improve those come with their own risk, and it can make things worse, right? So we don't want to do that. So you definitely got to be careful with that. Can I use castor oil as a nighttime lotion? You can, but I'm not a huge fan of castor oil. I think there's better moisturizers for sure than that. I had melanoma removed in April. Sentinel, it came back okay. I just followed up with another biopsy. So Carrie, for one, I'm so happy that you found your melanoma. I'm so happy it wasn't in your lymph nodes. I saw multiple of my patients today that had melanoma, deep invasive melanomas. I had 3 with invasive melanomas. If you remember, Carrie, yours was greater than 0.8 millimeters deep. That's why they did your sentinel lymph node biopsy. I had a patient today with 11 millimeter deep melanoma and a 13 millimeter deep melanoma. And some had positive nodes, and 2 of them had positive nodes actually. So we're thankful that we have better therapeutics than we did before. But I'm so happy you caught it. I sure hope your biopsy's negative. Can you pick or pop pimples on Accutane? Absolutely. I'm so happy that Christine, that you've been using the Brandify products and you love them. If you guys don't know, Brandify, incredible skincare brand. And again, if you use the Greeney 40 code, Greeney 40, I'll put it in the chat here. The Greeney 40 code, if you use that, Greeney 40 on Brandify website, you can save 40% off. They have the best vitamin C. They also have some pretty amazing sunscreen that you can get for like probably less than 20 bucks like that. Very good. Clindamycin can definitely be used before sleeping. What's the best cream for PCOS? Really, there's no good cream for PCOS, but things like birth control can help. Maintain a very healthy diet. You want to exercise. You want to eat right, because a lot of times obesity contributes to PCOS. Mia says, I have one more question. Mia, you can ask all the questions you want, okay? I appreciate you being a skincare bestie and a subscriber and helping us get dubs in Warzone. I have one more question, sorry. What can cause splitting skin on a 3-year-old toes and split toenails? Well, there's a lot of things that can cause the split toenails. I mean, nails can be tough. I mean, depending on the shoes that are wearing, open-toed shoes, trauma, stuff like that. Splitting skin sometimes be caused by superficial bacteria infections. Probably one of the more common things. Some kids get some types of peeling skin from wearing like rubbery shoes or sweating a lot on the those kind of things. Those kind of things can cause it, but if it's not super pink and inflamed, I mean, I would probably just try it first, just using like CLN body wash, just to decrease bacteria on the skin. Carol with the $2 super. Thank you, Carol. I appreciate it. You're awesome. Thank you so much. I really, really appreciate it. Carol, if you have any questions at all, feel free to drop it in the chat. Again, if you guys drop the supers, I really appreciate you guys being here, and thank you for supporting the stream. It's great to see, and I like the little hey you thing. So thank you so much, Carol. Make sure to ask your skincare questions in the chat, because I want to help you. So I have vitiligo on my face, and it's getting worse every year. How do you deal with it the best? So vitiligo is pretty tough. It basically, vitiligo, for what you guys have seen, is kind of what Michael Jackson had. Essentially, your immune system decides, hey, I'm going to fight off the melanocytes that are in skin. Melanocytes make melanin, and they make the color of your skin. So everybody has melanocytes, and everybody has melanin. White people have melanocytes, doesn't matter. Hispanic, Asian, Indian, everyone has melanocytes, and everyone has melanin. But people with darker skin types have melanin that is more diffuse and spread out, and the way that the melanin is spread throughout the skin is different. So when people have their immune system reacts and attacks the melanocytes in our skin, it can cause loss of pigment. And so there's a couple ways to treat it. By far, the most common thing we've done over history is treat it with topical steroid creams. But now there are steroid-free agents called JAK inhibitors that can be applied to the skin. And we're dealing with lots of vitiligo all over the skin. Then sometimes what's called narrowband UVB phototherapy is used. And that uses a very narrow wavelength of light to suppress the immune system in your skin and reduce the damage to the melanocytes. So that can be done. How do you deal with eczema? So, Mary, eczema is a type of skin condition that's very frustrating. Most common in childhood. It tends to get better with time, but some adults can get it. It is treated in a variety of ways. It's a deficiency in flagrin, which is kind of like the sticky glue that kind of goes between our skin cells, which means that external things are able to get into your skin a little bit easier. It also lets water out through your skin a little bit easier, which is very, very frustrating. So the base of the pyramid is maintaining very healthy hydration of your skin, which means applying a really, really good moisturizer. So I like things like CeraVe cream moisturizer. I also like La Roche-Posay triple repair moisturizer. So these are good. Now, interestingly, with eczema, another thing that's deficient is the ability for your skin to fight off infection. Your skin does not fight off infection the same way when you have eczema. When you have eczema, the peptides that fight off infection are less. So using antimicrobial cleansers like CLN body wash can help to reduce the bacteria on your skin that can be very inflammatory, like staph and strep. So we all have a microbiome on our skin, and those things that can be thrown off when you have eczema. The most common ways we treat eczema were topical steroids or steroid-free agents. Those things are used all the time to help to reduce eczema. For people with more advanced eczema, oral JAK inhibitors are used, or injections like Dupixent or Adbry. Those things can be used. And I want to shout you out for the onset super. Thank you so much, Mia. You're awesome. Thanks for popping over to the YouTube vertical live. I appreciate you being here. Something, it's been a little project of mine to get this going. So thank you for being here, Mia, and thanks for dropping the super. So I'm getting a third CO2 treatment tomorrow. Is there anything you could do to improve the results? So CO2 or any laser really is all about the settings. You've been through 3 treatments, which is pretty impressive. You know, a lot of times when I use really aggressive lasers like that, it's kind of one and done for me. I'll do one treatment and it's going to be very aggressive, and you're going to go through a pretty strong healing phase and hopefully get the result. But otherwise, you just want to be eating good, you know, want to eat good protein so you can heal, because, you know, you need that collagen formation and that good protein in your system to heal and get all the collagen that you can from your laser. So that's the big thing in following, you know, your wound care instructions. Some people use fancy things like elastin, which can kind of help. Is Coke Zero messing with your skin? Probably not. I think that would be unlikely. DFSP, as in the skin cancer, I definitely know about DFSP, Justin. It's not the most common thing, but people get it. It can be a little tricky. You got to go and get Mohs surgery done to get that removed. They look at it under the microscope, but it can be pretty tricky because it's basically these wispy little cells that are kind of hard to track down. So a small DFSP can get fairly big as you're trying to track it down and get it all completely gone. The interesting thing about DFSPs are they have been reported to spread in the body like a cancer, but I think most primarily to like the lungs it's happened, but still their metastasis I think is quite low. Sebderm advice. So if you guys don't know what sebderm is, that's seborrheic dermatitis. It's a type of almost like fancy dandruff. It can happen on the scalp, it can happen on the face. So for the scalp, one of my favorite things to use is if you're having a lot of flakes, I like Briogeo Mega Strength shampoo. And if you're having trouble with seborrheic dermatitis on the face, I like ketoconazole cream. That's a good option. Justin, you're welcome. I definitely got to see a dermatologist for that one, right? To get your best, to get that treated. Family history of melanoma. When should I get my moles checked out? Cody, I'll definitely be getting a check, you know, in your 20s and 30s. That's some time you definitely want to get checked out. Good news is melanoma is pretty exceedingly rare when it comes to the teenage years. You know, it's kind of rare to find melanomas at that time in our life, which is good to know. But in your 20s and 30s, it actually becomes a fairly common type of skin cancer. So we just talked about eczema just a little while ago. So maybe some friends in the chat can help you with that. What's best thing for melasma? So prescription wise, hydroquinone is kind of considered the gold standard for melasma. You guys got to know, if you have melasma, it's basically those hyperpigmented patches that a lot of people get on their upper lip and their cheeks and their forehead. It tends to be symmetrical. It tends to come up due to birth control or possibly during pregnancy. It's very, very frustrating. The thing you don't want to do with melasma is do lasers. Lasers can make it worse. Pretty much any kind of heat can make it worse. So you don't want to do those things. But other things that can make it better are things like chemical peels. I do some personal chemical peels that have hydroquinone in them, which is pretty cool. Or I prescribe hydroquinone and tretinoin, those kind of things. Beef tallow, I'm not a fan about. Mushroom type lesion 3 color stands high off the skin. I would definitely get that checked out. You can have them things that are kind of mushroom shaped that are completely benign, but you can also have some bad things with multiple colors in it, like melanoma. So I get those all checked out. Acne scars, I treat with lasers. I treat it with lasers. I treat it with peels. I treat it with microneedling, all of those things. Minoxidil will shed all the long hairs. What about, I think you're asking about dutasteride topically. Any kind of those topical treatments or minoxidil, the whole goal is to get your hair in anagen growth phase. You want your hair to be an active growing phase. So any hair you shed is only because it's the resting hair that is just doing nothing besides sitting there. And you want actively growing thicker, fuller hairs. So, so that's something that I'd kind of look at. Dutasteride, could it shed your hair? It's kind of more about blocking the DHT that causes hair miniaturization. So I don't know if the shedding result is necessarily the same with that, but yeah, I think any of them could do it. But you got to keep your eye on the prize when you're doing these things with hair treatments. You got to just stick with it 3 or 4 months, kind of best results of the year kind of thing. And always keep in mind, it's always easier to keep hair than regrow it. So we got a couple questions here. So Mia says, could it be from him always wearing Crocs? They're like a black straight line splits under his toes and really pink on the inside line. Says they always hurt, but they always gave him a steroid. Yeah, so that could be definitely helpful if you're getting that irritation. The other thing is you could just do a good gentle, like kind of like a barrier cream. If you're wearing Crocs, I know it's not super fashionable, but always wear, a lot of these kids do get that kind of cracked, fissured skin. I'm trying to think of the word of it right now. Kids, sandal, peeling feet. I'm trying to think. What's it called? I can't think of it for some reason. It's got a very juvenile plantar dermatosis. So juvenile plantar dermatosis is probably what it is, and it's not very fashionable. But what you could do is wear socks with the Crocs. Sandals and socks is one thing. Socks with the Crocs, that's the move. That's the prescription. Write it down. Socks with the Crocs, to ward off that juvenile plantar dermatosis. You heard it here first. Socks with the Crocs. Kaylee Hammer, Cab Trio skincare routine. So Cab Trio, the beauty of that is you're getting 3 great treatments in on a single cream. It's amazing for acne. For some people it can get a little irritating, but the good news is you're getting 3 great creams on all at once. So you're pretty much going to do your Cab Trio at bedtime, and the only thing you might want to do is a moisturizer after and gentle cleansers. So all you're going to need is like a CeraVe cream to foam cleanser. I really like that one. If you got particularly oily skin, just use a CeraVe foaming cleanser. And then, so you could do that. And then your Cab Trio at bedtime and a moisturizer on top. I like CeraVe moisturizing lotion. It's oil-free, non-comedogenic. That's the one I'd go with when it comes to that. So shingle scars, really tough. There's probably not a ton you can do with that. You might laser it to remove some of the redness. Millie in sensitive areas. I mean, you're not going to be able to treat Millie at home if they're like that. I would be going to your dermatologist. They can poke and drain those. Can you dermaplane on textured skin? Dermaplaning too frequently can tend to break you out. So that's the one thing I'd be a little bit like leery of. So that definitely can happen. But you can do it on textured skin. And in fact, if you have a lot of dry, dead, dull skin on the surface of your skin, dermaplaning can help. But I generally recommend doing like it every 4 to 6 weeks or so. Would you know why I get really red after I work out? So a lot of people do this. We got to keep in mind a lot of the color of our skin honestly comes from like the blood flow in our skin. And when we work out or we get in the shower or anything like that, a lot of those blood vessels dilate. You're going to look more red. It can be a type of rosacea, but it also could be just like a normal variant of your normal skin. So those things can happen for sure. But it's nothing that's abnormal. There's a few medicines you can do to kind of prevent that flushing. Open pores. So Muhammad, great question. With open pores, there's no way to get rid of pores permanently. So first of all, one of my favorite treatments for it is Remedy for pore size. But if nothing else, use a really great cleanser with salicylic acid, 2% in it. And cures for rosacea, there's no cure for rosacea, unfortunately. There's ways to improve it. If you're dealing with redness of rosacea, I would do laser. If you're dealing more of bumps of rosacea, then I would lean into more of azelaic acid. That's a good option for it. So alternatively, for Accutane, there's nothing like Accutane. So Accutane's the best thing that there's for acne and the only thing that can cure acne permanently. But there's a lot of other things that lead up Accutane, I don't really have a favorite growth factor as far as peptide serums. I really like the Ordinary multi-peptide serum. That's a good one. Hair dandruff, again, hair dandruff, you can use zinc oxide shampoos, selenium sulfide shampoos, and then ketoconazole shampoos. These are all very good. Tretinoin under the age of 18, absolutely. In fact, most of my patients that are on tretinoin are under 18 because it's used for acne. The longer you use tretinoin, the better you're going to do. Do you recommend zinc soap for dermatitis? It's not something I usually jump to. I don't think it's necessarily going to be harmful for you. Dermatitis a lot of times is about, gentle skincare products, hydrating your skin, avoiding things that irritate your skin. Zinc soap, plus or minus on that. Doesn't really, make it or break it for me. So let's see here. So what else we got? Long-term effects. Do I have to cleanse in the morning if I am? Let's see. Can I use tretinoin if my acne is not bad? Absolutely. Everybody honestly should be using a tretinoin, a retinoid, or retinol. That's the top 3 skincare recommendation for me. So I strongly suggest that people use that. So it's absolutely a good idea. Long-term effects of breaking your barrier too often. There's no long-term effects of it. I mean, your skin is going to heal. Your body is an amazing, amazing system, and it can pretty much heal your skin no matter what. Now, if you overdo it, like a thing like a scar or a burn or something like that, I mean, you maybe never have the exact same skin. It's really hard to overdo it with just like over-the-counter skincare. I mean, if your skin gets a little irritated, you stop it, you heal your skin, and get on with it, Small bumps on the forehead, it's tough. If they're itchy, I would maybe lean into using like Nizoral shampoo as a face wash or something like SwoleMD soap. If they're not itchy, it's probably more in the acne spectrum, and I would kind of lean into doing things like that. So, yeah. So let's see here. What else we got? Is Accutane easy to get? Chat's going pretty quick. Thanks for all the great questions. The people that drop the supers, man, you guys are it. You guys are everything. I appreciate you. Dylan, why am I saying so damn cool? I don't even know, man. Hard saying. I don't even know how it is. I stay cool with that thermal spray, Treatment for IGH, idiopathic guttate hypomelanosis. Unfortunately, there's not much. Arguably, maybe you can use microneedling with Latisse, but that might be something you could do. But really, there's not a lot you can do exactly. So how do you guys feel about this? What I'm about to do is I'm about to switch over. I'm going to get Boolong on, and we're going to do gaming and skincare Q&A. We're going to be gaming and skincare Q&A. If you guys want to be here for more skincare Q&A and you like this, tap the follow right now. Tap the subscribe right now. Make sure. Thank you, Mia, so much for the super, the big one up with the chomp chomp. Appreciate it, Mia. Thank you, thank you. If you follow now and hit the notification, because I'm going to go live again in about 5 minutes, and I want you to be here. I'm still going to do it. We're going to go live again, probably be on another hour at least. You guys could be the first people in the chat. Tap the subscribe, tap the follow. Thanks for the supers. I'm going to shut it down just for a moment. I'm going to switch over to gaming and skincare Q&A. You guys might have heard it, but doctors who game make 30% less errors or 24% less errors. So I'm going to be gaming and answering your skincare questions live. So tap the follow right now and tap the subscribe, turn on notifications, and I will be here. Okay, guys, make sure to be there. Is there any good lash serums that don't give eye redness under the eyes? Mia, I would get Babe Original lash serum. It's very good. And it's safe. I would go with that. So yeah, guys, I will be back in just a second. Okay. I'm going to be back in just a second. Tap the follow, tap the subscribe, guys. We're going to be here live. We're going to answer skincare questions and game. All right. I'll be back in just a moment, guys.